Playboy Playmates. They're epitome of physical beauty, but what happens when their most prized assets impact their health?
Recently, 3 former Playboy Playmates, Crystal Hefner, Kimberly Holland, and Karen McDougal, all had their breast implants removed because they say they were suffering from breast implant illness. Playmate Crystal Hefner removed them last July because she says they were slowly poisoning her. A month after getting her implants, Kimberly Holland broke out with a rash on her back that kept recurring. According to her, she also began getting chronic dental infections and developed Raynaud's disease. Then former Playmate Karen had the same issues. Over the course of having her implants for 21 years, Karen says she started having thyroid and adrenal problems, developed severe allergies, blurry vision, dizzy spells, joint pain, brain fog, and was even blacking out. Could these implants be making these Playmates sick, or is it just coincidence?
Joining us now is Karen, who's a former Playboy model, along with her plastic surgeon, Dr. David Rankin. And Karen, I understand that you have had your implants removed.
I did. I had them removed 6 weeks ago. And honestly, the day after surgery, my blurry vision went away. My heart palpitations went away, and my hearing sensitivity went away. I'm only at 70% right now. It took me 21 years to get sick, so I know it's going to take a progress, or be a progress, but I feel great. I feel like I have my life back, and that's what's really important for me.
Well, you know, the proof of the pudding is that Karen feels better, she's doing better, but I've been doing breast surgery, augmentation, reconstruction using breast implants for 35 years now, and I can say unequivocally that it's a safe and very effective procedure, one of the most popular things we do, with a hugely high satisfaction rate. But I think there are a certain number of people that when you put this foreign body into your body, your system, your immune system is working against it. Not to reject it, but just its inflammatory response, it's ongoing, that I think can cause some of the symptoms.
And let's talk a little bit about more and more individuals are saying, okay, for whatever reason, whether it's for the appearance or, as in your case, Karen, you just wanted these out because you had all these symptoms. Dr. Rankin, technically, with Karen's surgery as an example, what does it entail?
The surgery, it's called a breast explant, so it's removing the breast implant itself, and you want to get the full capsule around the implant. And what the capsule is, it's an immunologic reaction. Your body's trying to wall off any foreign body, but we're starting to see a certain subset of women that are developing these problems.
How would you explain what was going on with Karen? Similar to what I said, probably a reaction to the capsule.
That's what I think.
Because it's not free silicone, because she had saline implants.
Right, even some of the studies have shown that there's some seepage of the silicone shell into the outer area, and this may potentially cause an immunologic reaction where the body is causing these symptoms and causing these problems in the patients.
Really quickly, Karen, I know you were trying to get a word in there.
Well, I was going to say, I was blacking out on a daily basis. I was pretty much on bed rest for 5 months, and I couldn't do anything, and I was having hearing sensitivity. My own voice bothered me, and I'm just so grateful to be here.
And clearly, Karen, you've had a really positive result. I think the takeaway here is if you do have breast implants and you're concerned about them, go talk with either the plastic surgeon who you saw initially or someone that you trust. And want to thank you, Karen, for sharing your story. Dr. Rankin, thank you as well. Stick around.